Okay, so welcome everybody to the webinar today. My name is Amy Anthony. I'm the Communications and Outreach Manager for the Hassenfeld Child Health Innovation Institute, which is a partnership between the Warren Alpert Medical School of Brown University and the School of Public Health at Brown. So we were founded in 2016 with the mission of making Rhode Island among the world's healthiest places for children. And I'd like to introduce our director, Dr. Patrick Vivier. He is a professor of health services, policy and practice, and professor of pediatrics, and professor of emergency medicine at Brown University. He is the director and executive committee member of the Hassenfeld Child Health Innovation Institute, and he is also the director of interdisciplinary education programs at the Brown School of Public Health.
Thank you, Amy. We're really excited today to have this chance to talk with all of you and hear from two incredible experts who are really here to answer your questions. We appreciate that folks have sent some in that we have lined up. You'll be able to submit questions throughout this as we're going through this session, and we will try to answer as many as we can during this time period. So we have, as I mentioned, an incredible panel. First introduce Dr. Stephen Scheinkopf, who's an associate professor of psychiatry and pediatrics at Brown University and a clinical psychologist at Women and Infants Hospital, as well as Bradley Hospital. Dr. Scheinkopf's research interests focus on risk for autism in infancy and on improved understanding of heterogeneous outcomes in autism spectrum disorders. He is the director of the Rhode Island Consortium for Autism Research and Treatment, as well as being the lead of the Autism Initiative at the Hassenfeld Child Health Innovation Institute. Joanne Quinn is also an important member of the Hassenfeld Child Health Innovation Institute, working specifically on our autism and play work that's in collaboration with the Fashion Institute Technology. Joanne is the executive director for the Autism Project. Her interests focus on teaching how to support people with autism across their day so they can live a purposeful life regardless of the level of support necessary. She's passionate about parent and professional education on the best practices for teaching and support of autistic people. She's a member of the leadership team at Ricart, and thanks her greatest teacher of all, her son Patrick, a young man with autism. And before we even get started, the first thing I will throw out, maybe to Joanne first, and Dr. Scheinkopf, if you want to jump in. I know within the autism community, there are different approaches to using language in the way that we refer to autism and the use of the words like autistic. Do you mind just talking a little bit about that? I think to make sure folks know we're sensitive to this and how we'll handle it in this session.
Thank you, Patrick. Yes, we've heard in recent years, the last couple of years, especially from self-advocates, and it's not 100% self-advocates versus parents versus other individuals with autism, that they prefer to be referred to as an autistic person, and others prefer to be referred to as a person with autism. So what we do at the project is be directly with somebody, ask them how they would like to be, what they'd like to be called, referred to. If not, as in today, we'll go back and forth so that we respect both sides in the use of language, and everybody is referred to at how they would like to be referred.
Great. Dr. Scheinkopf, anything to add on that?
Yeah, I think it reflects the great diversity of people that we have, the honor of working with when we work with families and individuals with autism or autistic individuals. I think there's just a great variety of personal preference for individuals and the families in terms of how they want to be referred to. So in part, I think that's part of the joy of being able to work with individuals on the spectrum, so to speak, because frankly, I find that fascinating and interesting, and we always want to be compassionate and respectful about how individuals are wanting to be referred to, and recognize that there's just great variability of that. We want to be inclusive and compassionate on that issue.
Terrific. And in terms of my practice during this session, as I'll be reading your questions, I will, to the best that I can, be reading the questions in the way that you ask the questions. And so we'll use the language that is used by our participants. So that said, we'll jump into the questions. I think you are able to, Amy can confirm, put in the chat if you have a question at any point along the way. I'll also bring up that we are recording this. And so if there are things that are said that you want to be able to refer back to, as we'll mention at the end, this will be available online, the recording, to be able to go back. So as we did in the title of this, this is about autism questions in general, but also specifically, nothing we can discuss these days doesn't involve COVID and the way that that has changed our lives. And so why don't I start off with that question, not as we've all been through this past semester, but now we're looking into the fall. A family writes, what can we do to support our ASD children at home this year if most public schools are going virtual? Now, we still don't know exactly what's going to happen in the fall, but why don't we start off with you, Joanne, to sort of talk about how do we support the children as well as the families, both if it's virtual or in this case where there's all this uncertainty that affects routines?
I think the most important core value or item that we need to do is get information in a timely manner to for everyone, for parents as well as for autistic individuals. It's the not knowing, it's the grade does not do well for any of us, as I think we're all very anxious, but if you're also more of a black and white thinker, it's the more information that we can give you, even on a daily basis, to give the information of what's to expect, what's expected, what do we know. We can write social stories or social narratives of sometimes, we just don't know for a while, and that's okay. We'll let you know the information as soon as we have it. So I think even with calendars, if you can put up on it, I will give you an update every other day of what I know. And as the days go by, it's Tuesday, I have to give you an update. This is what I know today. I'll let you know more on Thursday. And to help with the passage of time, with the information. But in terms of the anxiety about what's going to happen, is it going to be live or is it going to be distance learning? The more information, unexpected surprises we can eliminate, but information that we can give as concretely as we can give, what's the best learning for that person to receive the information that can help them so that the anxiety is manageable, because we're all anxious. I know I don't like transitions to that information either. So the more we know, and it's changing by the day. And so that's really hard for everybody.
Dr. Scheinkopf, do you want to weigh in on that as well?
Yeah, I mean, I think that Joanne alludes to three levels of way of thinking about it. We need to push our systems, the school systems and others, to, as Joanne's saying, communicate clearly with the children that they're charged with educating, so that there's an expectation to the best, everybody's doing the best they can, I think, in this uncertain time, but to the best possible, help families and the kids that they're raising appropriately anticipate what's going to happen, so that we can, not altogether avoid, but minimize surprises. And I think for parents and teachers, I think of one, supporting routines and paying extra special attention to healthy daily routines. When kids go to school, that's part of the routine. There's a rhythm to getting up, getting on the bus, going to school and coming home. And I know for myself personally, that's really hard to maintain, in the stay-at-home period. So I think that's part of the supports we want to offer to kids. And I think then also for teachers and parents, thinking through what is really the right expectation for your child. That's going to be very different than the child around the corner. For some kids, it's going to be maintaining these higher level academic goals, and that's the appropriate goal to have for them. But for other kids, it may be more appropriate to dial back and to think more about daily activities of daily living and those sort of in and outs of daily living skills that are equally very important and sometimes very challenging for kids. And being at home sometimes can be an opportunity to work on those in a way that wasn't sort of possible when you're rushing to and from school. So, I think there are different ways to think about it. But those are a few things that I think about.
Staying on that, I'll stick with you, Dr. Scheinkopf, and then Joanne, you can weigh in. A mom specifically writes that her daughter's having incredible stress in this time of not being able to get to school, including pulling eyelashes and having other issues, and clearly struggling with this. coming into the school year, it happens that there are also family medical sensitivity issues in the house. So going back to school isn't going to be an option. Are there ways that they can work with the schools, specifically thinking of 504s or other plans that they should be trying to work on now this summer to try to work out a system that can support the child, given the child is likely not going to be able to go back to school, even if in-person is possible for most kids because of the family illness at home?
There are a lot of layers to that, right? So one layer is the difference between 504 plans, which is about statutes that dictate that schools really need to be, to the best of their ability, including individuals with disability in educational opportunities, which is different than an IEP, an individual education plan, which is the specific specialized supports that are available. My understanding, and Joanne, you might weigh in on this as well, is that when children have an IEP, the 504 tends not to be in place. Everything is sort of organized through the IEP. And then the 504 plan is oftentimes useful when children may have needs for some special accommodations, but those needs don't rise to the level of a need for a special education plan. So I think thinking about where your child fits in the level of the special needs disability bureaucracy and terminology is a useful place to start. But more generally, backing away from whether it's an IEP or a 504, we're talking about accommodations that can help people be supported in the, in the context that we're talking about. One thing I think is, I don't know the full answer to this question, Patrick, but one of the things I think can't be understated is reaching out and having that collaborative conversation with the school, opening lines of communication earlier than later to problem solve together, I think, is one way to go. The other way to go, especially when you talk about anxiety, depression, and those sort of mental health service needs, is to recognize that schools can't do everything, that there are limits to what schools have under their umbrella, but there are also other resources out there for families. And so a lot of psychologists, social workers, counselors in the state have been making really strong headway to be able to deliver mental health care, family and individual counseling through telehealth, telephone or video calls. And so I think that's just a resource that families need to know is out there. Even if you can't get to an in-person clinic, there are psychologists, counselors out there who can help as well, and that can be a resource people reach out to.
Joanne, do you have other thoughts? And this parent did specifically ask about the 504, which I guess was in place around an in-person setting, but now they're trying to learn through a computer. Additional thoughts?
I understand the 504 is more for accommodations versus modifications or change of the actual work. So it might be, like Steve said, time for a conversation with the school to say, I am mom, I'm not a teacher, I don't know how to make these accommodations or these changes. Can you help me? To see how the support, when we all went virtual, it was overnight, but now we've got a little more time to think about it. I think a lot of parents need some support as to how now to be a teacher. And they can ask their schools, but the Autism Project, we also have some webinars that can help them with that, and we have support groups that can help you with that, because if you're going to be long-term and you haven't had the education yet as to how to support your child, and your child is very different now than probably they were 15 weeks ago with the anxiety, and they're going to need a higher level of support. But like Steve said, the routine, make a routine for the day, get up, get dressed. We can't have our COVID, yoga pants and t-shirt forever, and get out, have a purpose of what you're going to do, even just a couple of things that happen every day so you get back into that structure and get into your new normal, but it's a productive normal. That helps with the anxiety. And then again, the transition back into school, it needs to be a conversation with the team. RIPEN also has a lot of information, Rhode Island Parent Information Network, on 504s and IEPs, but the legality of it and how to approach your team to call a meeting. And that might be appropriate this time if she's really different than she was 15 weeks ago.
The next question is a very specific one that I think affects all families with young kids are struggling with. But basically, are there ways to help your child on the spectrum to wear a mask?
Yes.
Joanne, sounds like you have an answer. How do you do that? I think all parents are struggling with that a bit, but specifically.
I got my husband to wear a mask. I can get anybody to wear a mask. First, don't underestimate the kids. You know, all of our kids are rule followers. You know, they like to please. Kids in every classroom across the ages. But again, it's information. Why do I suddenly have to have this cloth or paper piece of something mask on my face? So we have some social narratives here that we can share with people. I think I gave them to Amy to share at the end, of how to practice, how to do modeling, how to explain whether your child is nonverbal or verbal, why we are doing it. It's really important is why behind it. And perhaps how long do I have to wear it for? If you can say you need to wear it when you're in certain situations. But practice, practice, practice. Don't underestimate the kids we thought would never wear them. Yeah, no problem, on it goes. Other kids needed more explanation. So tell them why, show them the modeling, show other people wearing it, and practice, practice, practice.
Dr. Schein?
I'd weigh in, Patrick, that one of the comments I noticed in the Q&A here too is a really good suggestion, which is to not only take it slow, but start in small bites, small amounts of time, treat that as success. And I think that's true for many of the things that we want to help and support the kids we work with to do, which is to set expectations in a way that are at first are really achievable, so that kids can get this experience of having success with something, and then these things become more attainable, less scary, and you can sort of build from there.
Terrific advice. Joanne, there's a second person brought in the issue of the mask, which I think both of you have answered well. But this person who submitted also brought in, are we, your group, others, working with the community, the broader community, in that there, for some children with autism or adolescents, wearing the mask just might not be possible at some times, and that in public, this can be an issue. Are there education campaigns for the broader community to help understand about this, or is this something we should be working at with Hassenfeld or with you in the Autism Project? I thought it was a really important point to bring up.
You know, they do have the ADA exemption and different things that make it legally okay for them not to have a mask on. But a lot of times it's also educating the community as to why. And we did this years ago when the kids were little and they'd be having a meltdown in the middle of a store, you know, and you get all the judgment and people making their comments. And a lot of parents use a little card the size of a business card that instead of having to verbalize, you just hand it off to them saying, you know, my son is autistic and wearing a mask is very uncomfortable for him. And just hand it to them to give them some explanation. But we should do some public campaigning. I think it's getting tied up in all of the politics of it too, and people are misusing it, which makes me angry. But there are kids who aren't going to do it, or he'll do it on Thursday, but there's no way on Friday for whatever reason it is. But it also, with the little card, it takes you out of the fishbowl. You don't have to sit there and, oh, I'm really sorry. You feel like you're apologizing to somebody. You can just give them the information. Here, you know, this is why he doesn't have it on, and we're being careful to keep them 6 feet apart. You know.
Terrific. Yes, as this participant brought up, there can be sensory issues or other issues that
absolutely
make it very, very difficult.
Mm-hmm.
There are a series of questions that come from a number of people that I'm going to do my best to summarize and bring together. If I don't do the right job, I ask you to put these in the Q&A so that we're responding. But a number of questions around adults and autism. And this, the sampling is quite broad, from a member of the Brown class of 01 who identifies as Asperger's and wanting to know is participating in this, to another a parent who brings up that their 22-year-old son has been taking a couple of courses each semester at a local community college. The COVID online format has worked out well for him. He's registered for online classes. There've been bumps, but really academically he's done well, but is fortunate to be connected with really accessible psychiatrists and others. But then other families bringing up of what a struggle it is, and that there can tend to be a lot of programs for younger children but that as we get to college choices or trying to find employment, of really struggling without adequate programs for adults. So rather than me reading each specific one, can you sort of talk about this? The success stories of things that you recommend, or where we struggle with this as a society and need stronger programs for adults. If you can both weigh in. I guess, Joey, you spoke last. As Dr. Steinkopf, why don't you jump in first of this age group? What do we do, adults?
I think this transition to early adulthood in particular, we know is a real, not always a huge struggle, but it can be a struggle for individuals. And, I think there's just such a heterogeneous group of individuals we're talking about here. So the conversation is very different when we're discussing the individual with minimal verbal skills who frankly needs very high levels of support and close supervision, as compared to individuals who can more independently hold down a job, live independently, or at least with minimal support, go to college, and everywhere in between. I do think that as a society, and this is not a satisfying answer, I think, to the parents who are struggling with this in the here and now, but as a society, we need to do better. And I think that's true for people with developmental disabilities of all kinds, not just those on the autism spectrum. And in part, it's about being able to, for as a society, to really be inclusive of people. And this is a community we need to be inclusive of. And to recognize that there are some odd, sort of idiosyncratic ways that people need support. So there are individuals who are extraordinarily intelligent, but because of the symptoms of autism, may have difficulty with the nuances of the social back and forth in a classroom or a work site. And so even though they may have the cognitive and language skills to excel in those settings, they may run into trouble in terms of the interpersonal side of things. And so I think finding supports that go beyond simply teaching people a job, although that's sometimes very necessary, but also extend to, I guess from a human resources point of view, supporting people in the interpersonal parts of the job are also really critical. And these are really hard problems, I think, for companies to, and educational settings to tackle. I think there are colleges out there, speaking about schools, that are doing increasingly better jobs at this. I wish I had a list of the ones that I thought were great. I don't have that at my fingertips. I just know that there are some universities that have really put their best foot forward on this support. So I think for families who have children who are getting ready to go to college, it's worthwhile really doing the legwork and homework to find out just what those outside the classroom supports are that are available to help success on the campus in those settings, whether it's a commuter school locally here or a residential college. Joanne, I'm sure you have other insights to offer as well.
Yeah, my son's 25, and back in the day there weren't a whole lot of program options for young kids diagnosed with autism. That's when the real numbers started going up, and we've seen huge changes in the children's programming in elementary schools, middle school, and now high schools too, where it's not quite so much like when we hit the high school and it's like, well, this is how we do it here. It's like, okay, let me know how it works for you. But they learned, and now there's a bubble of kids who are young adults who have graduated, who are either going to college or they are going into the workforce. And the community is reacting, maybe not as fast as we'd like. It really is hard because up until 21, you're in an entitlement system. You're entitled to a solid education. And now in Rhode Island, it's up through your 22nd birthday, where you get the supports and education through the public schools, to now you have to prove you need it. That you go from having full day programming and support in the afternoon on the day before your 22nd birthday to perhaps nothing. No day program, no transportation to it, and just prove, and living options. So, but they're feeling the pressure because the numbers are there of people who need support. Universities do. They have separate programs specifically for students with IEPs, where before it used to be, no, if you're coming to college, you have to do this. Your mother can't call for you. Your mother still can't call for you, but you work at the disability office, and they have set different programming in many universities to support those with the academic chops to go, but also helping in the dormitory, a single versus a double and things like that. And corporations, ORS has several work groups going, and corporations like CVS, Blue Cross Blue Shield, Amica, they are absolutely working on specifically how to support autism in the workforce, how to help people get through the interview process to get what they need to do, serum compliance and whatever they need to do, but modifying it and working with individuals who can absolutely be great employees to get them through that. But even more importantly, you need to train the managers and other people who will be the landing site for these individuals to understand what's going on and how you might have to do some changes, and not this is how we do it here is really not said as much. And they're really committed to autism in the workforce. And you see a lot of stuff on the news and all that, but unfortunately it takes time. I know as a parent, it's very frustrating. Because they're 25 and we all knew they were coming, and here they are. We fed them and they grew, and here they are ready for the real world. And when they sit home, they lose so many skills so quickly, and the amount of time and energy we invested in the educational system, there needs to be a faster shift. I think it's coming in the adult system, especially here in Rhode Island, but there's a lot of work to do.
I think I can add a couple of things, Dr. Vidia, if you wouldn't mind.
Please.
I think there are, national sort of model programs that maybe will be proven in the future enough that we can maybe import them here, that are sort of training workshop programs that help people get ready for the workforce at an appropriate level for themselves. I think the other thing, and Joanna, I've known you for so many wonderful years that, I have a sense of the kids that you and your program have worked with. And I think sometimes I think we need to focus on the systems and advocate for the systems to change, as we've just described. But I also think that schools and families need to be also realistic to, in earlier adolescence, really plan ahead and balance the focus on academics with a focus on everyday life skills that don't always come as naturally to the young people we work with, that need to be nurtured very specifically, that are taken for granted for kids without special needs, so that when they get to 21, 22 and exit the school system, that embrace of the education system, we've helped them get the skills that we can in that time period. So I think it's about advocating for systemic changes in our state, in our country, but it's also on an individual basis for the kids, trying to really prep them, and support them as they get closer to those transition periods.
And to allow them to do both and still come out with a diploma. Because without a diploma, if you apply online, it goes through their algorithm and boom, you're out. Oh, you don't have your high school diploma. That's key. Not everybody doesn't need to be on track to go to college, and we need to embrace that, and we need to embrace more schools like Davies Technical School, where you're learning a trade, or you're learning life skills, or you're learning how to be employed while doing the academics, so you can come out. You have to live 22 years old. There's a lot we can do to help somebody cross the finish line for the diploma, as well as coming out with some real skills so that they can have a purposeful life. And not everybody needs to go to college, and we need to do that for all kids to reduce the stress, and all families who don't have the money for it, that we really need to support some other tracks of learning to embrace all kids.
Two things. One is, I just want to point out, because several have asked these same questions. You brought up, Joanne, your wonderful son, Patrick, who has a great name, by the way, and many fine qualities.
Yeah.
And I think one of the I'm sure is a frustration that this parent brings up is, as you were saying, this was the crew that you had to fight to get all these programs for the young that are now thankfully in place, but now they're at the age where they're having to fight for the programs as young adults. And they've certainly been trailblazers for those behind, but certainly a frustration that sort of had to do that at each age group. I didn't know if you wanted to sort of respond both in the positive way that you responded, that to see that progress younger, we hope it'll be in the older, but just recognizing that effort it has taken and to still at each age have to break down those barriers.
Yeah, and it's exhausting. And I know those parents are probably as exhausted as the rest of us are, because, you're at 20, 25 years old and you're still figuring out day-to-day life and programming and everything for your kids. You love them, but it's exhausting, and you can say that out loud. But there's also there's wonderful people who run the programming, the organizations that do the childhood programming and who do the programming financed by BHDDH. They are doing the impossible on ridiculously low reimbursement rates, and that's got to be a policy change that we are advocating for. I have been on a call with children's programs 3 times a week, and now we're on once a week, on how to get through COVID and still come out on the other side alive and open. But afterwards committed through the leadership of CPN, Community Provider Network of Rhode Island, to really bring this to the state that we're failing these families and kids because we can't maintain the staffing and the overhead and everything else that's necessary that has proven outcomes. So I think that's got to be as a state and as a country, because Rhode Island is actually ahead of it in some of the Medicaid reimbursement. We need to get it so that these organizations who keep showing up every day to do the impossible, and when I say the impossible, just the logistics to get people in the homes or places to teach our kids, they are so committed to it that we need to put the money behind that and the continuation into the adulthood, so that it's quality. The people have a good career. They want to do it. They want to stay in this career, but you can't do it when you make $12 an hour. And the only way to move up is to become a supervisor. You want to be a supervisor. You want to work with people. So I think as a policy, we are advocating for that. We're working for that. This group of all the organizations in the state are collaborating, working together brilliantly just to help each other through COVID, but beyond COVID, to say, okay, coming out of COVID, we still need to talk about how we can better support these families.
Terrific. Now, I don't want to put both of you on the spot, but in this, you brought up some number of vocational training, which people have specifically asked. Is it reasonable if we work with you and Amy get together, in addition to posting this recording, if we can maybe put together some links for people to follow up on specific programs around vocational training? Dr. Scheinkoff mentioned colleges that do a particularly good job of things we know about now, and I'd be happy to pledge the Institute's help to put some people to do some resources to dig. Is that a reasonable ask that we try to get up on our website?
Absolutely.
Terrific. And I think following from that, which is also a parent called, is asking us to help advocate for these programs, which Joanne, I know is your life to do. And we would be happy to partner with you to figure out how we do that, particularly for the older age group that a number of asking about.
Thank you.
To round off this discussion of the older age group before we get back to some school age, a parent also specifically asked about aging out for specific services, not even necessarily on the financial side, but physical therapy, occupational therapy, other programs that might hit an age group where they're not working, focused on adolescents or even young adults. And this parent has found they have to look in Massachusetts or other places. Again, not just an insurance question, but just finding appropriate providers for things like PT and OT and all of that stuff. And any thoughts about that?
Well, I think there's there was another question like this, Dr. Berrier, as well, which is a notion that there may be relatively higher proportion of services available for the younger kids than the older kids. And I think that's unfortunately probably true. Yeah, I don't, we have resources, including vocational resources, on our Reichart, Rhode Island Consortium for Autism Research and Treatment webpage. And so we can certainly work with the Institute to help integrate that information together because some of that's been collated, and Joanne and her team will have additional information. I don't have great suggestions for exactly which physical therapists or occupational therapists are going to be willing to work with the teenagers. Other than that, we need to keep searching and identifying those individuals. Joanne, I think your team, just through experience and working with families, may have some inside knowledge about the providers in the state who, who may be more likely to take on clientele in that age group. And so that's a question for you. I don't know if that's true or not.
There's not a whole lot, but I think if you give a call to TAP, Sue Bayless, Jewel, or Alicia will have information on it. It does come down sometimes to the insurance. That's why we fought for years to get the insurance coverage through commercial, Blue Cross Blue Shield, the others, Tufts, to get interventions for kids with autism. Birth through 21 to get the insurance to pay for it. Now it's older to get insurance to pay for it, because in some plans it said unless it's a diagnosis of autism spectrum disorder, because the schools will take care of it. Well, not so much, and so give us it. I don't like to sound there's no hope, but there is hope. If you have something that you need PT, you need to get the doctors and all that. But give us a call and I can check with Sue and Alicia to find out. We give out lists of different people who work with our children and adults, and let the families call them. But I hear what this parent's saying. It just seems to fall off. And also finding doctors that take Medicaid. Because some of our kids on Medicaid through the Katie Becker waiver, or when you get into adulthood, you're on Medicaid. And our son was turned down by a doctor, and he's on our commercial plan, and Medicaid is the second payee, and they still wouldn't take him. So didn't know you could do that, but I guess you can. So we're all learning and figuring it out. But if we advocate about the need for it more and more, just like we did before, we'll make change. Because I know there's a lot of discussion on the federal level of transition, medical transition for all kids, whether you're medically fragile or developmental, the transition to find an adult doctor. Pediatricians can keep you just so long before you really need to get into the adult world. So it's a big discussion on the federal level too.
So again, you folks who are participating in this will receive an email follow-up from Amy, and in that will be an email address you can follow up with us. But we will try to work with both our panelists to coordinate ways to get on our website some of this information. The same parent had a different question that I know Dr. Scheinkoff wants to address, and that is, do you have there some peer-reviewed articles out there from Reichardt that the parent would like to read, and how do they get at them? Or do you want to talk a little bit about some of the more recent one that was published?
Yeah, we had there have been papers that have been published out of Reichardt, and there are more on the way. So the most recent, the two most recent manuscripts or papers that came out in the peer review literature, one focused on a description of the first 1,000 individuals who were enrolled in Reichardt. And I'll just sort of pause and, as an aside, thank all those families who so generously participated in Reichardt as a research study. Some of you may be on this webinar today, and your participation is really, we're really grateful for that. And I think some of the interesting things that came out of that first large description of the Reichardt study cohort included things like recognizing that girls are being, on average, diagnosed later than boys. So documenting that in a relatively large study sample that was pretty varied in terms of demographics and ability levels was important, and garnered some attention in the scientific literature, and I think is generating interest for follow-up studies. And so we have a couple of studies underway that are looking a little bit more deeply into the data to start to understand why that might be, and hopefully the answers to that why can lead to improved awareness to help narrow that gap between boys and girls with autism. Another paper that came out recently, led by my colleague Daniel Marino De Luca, who's a psychiatric geneticist at Bradley Hospital, described the rate at which people with autism are getting genetic testing, which is now a standard of care to at least have that available to individuals who have a diagnosis of autism and can sometimes be informative about the causes or etiology of the condition, and in some cases may help uh, sort of inform treatment decisions in some cases as well. And for families who have older kids with autism, where the diagnosis was made 5 to 10 or more years ago, the world of genetics is completely different now than it was then, and changing each year. So that's something to keep abreast of, and I think that is important as well. And then there are other studies that are underway building on the Reichart data set that will be coming out, hopefully in the coming months. Some of them trying to get a better sense of the influence of and the interplay between psychiatric mental health conditions that can co-occur with autism and outcomes for these individuals, um, as well as some more basic science neuroimaging, so brain function and structure questions as well that are just getting to be underway. So we'll have more studies as well that will come out. I'll make sure that we have links to the papers that have been published already on the Reichart website, which is autismri.org, but we'll make sure that those are linked, with Amy and the team at the Hassenfeld Institute as well, so people can have access to those pieces of information.
Terrific. So Amy will do that in the materials as well as the recording, and the website links will include those articles as well.
Sure thing.
Now, switching gears, this will go to you, I think, Joanne.
Okay.
Parent writes, how can I establish respite care and home-based services under the current conditions of COVID? How does one do that?
Yeah, that's another reason why that group of children's programming is getting together every day, is how do you deliver your services of HBTS or respite in a home safely? And what kind of PPE is necessary? What are the protocols? So the protocols have been put out by the Department of Health as well as EOHHS, that the overseers of Medicaid, on how to do that. And again, these organizations are working very diligently to figure what families are comfortable with and what their staff is comfortable with. You've got an early intervention model where you have therapists who would, in pre-COVID, see 6 or 7 families in a day. How do they cull that down so that you're not exposing as many families, you're not exposed to as many. What happens with a family that already has 9 or 10 people living in their house? You go over the allowed number. So still apply for, if you were looking for home-based therapy, they want you to apply. Early intervention parents, you can just call yourself if you have concerns. They want you to call past workers and others, and let them know what you're comfortable with, what you're not with. You can get through the evaluations. They can do those very safely. And then they do have some telehealth where it may not be the direct support person, but perhaps there's some time with one of their clinicians or the manager of the family plan who can touch base with you and works through some things until on both sides it's figured out how to safely introduce a direct care worker back into the family or a new one. But don't not apply. Please call. Respite also, our respite, a lot of the respite workers are family members, so the families know who they are. So respite is available, especially if you're on the Katie Beckett waiver and Medicaid. You get 200 hours a year, and actually that's the one program that's still making some money for us here with COVID. Everything else is shut down because it is your family, and you know what you're comfortable with. It's not it's comfortable on both sides. So call would be my message. Absolutely call.
I'm going to try to move quickly because I see that we have under 15 minutes at this point, and I want to make sure we get through everybody's questions. The parent who we talked about earlier about the 504 clarified some things. Is not so concerned about the 504 IEP of the specifics there. The parent's actually also a teacher, but really is trying to ask about online learning, and that specifically for this student, really the difficulty of looking at PowerPoints already and not being able to read facial expressions. The teacher is not there, and getting incredibly frustrated and slamming the Chromebook and just not being able to deal with it, of missing any of those cues. And so really just wanted to weigh in on any advice about online learning and ways that either parents or teachers can make that better. And before you answer, there was another participant who gave a suggestion, that is that RIPIN has a new webinar on distance learning and special education. I wanted to know if either of you know anything about that webinar, whether you'd recommend it. And then specifically for this parent, recommendations specifically around online learning and how to make that better or easier for students.
I have to say this is not an area of expertise of mine, and I think but I know enough teachers to have talked to them to know that it is super challenging, not just for kids with special needs, but for all kids. And some take to it beautifully, and some kids just don't. And I think this is, so I share the frustration. I don't know the answer. I might put a plug in for you, Dr. Vivier, to consider whether maybe there are some educators around the state that actually do have some wonderful ideas, and whether this sort of webinar might be in the future a venue that could help disseminate some of those things. Hopefully it doesn't put you on the spot, but that could be actually a very interesting contribution and opportunity. That's my way of deflecting, because it's just not my area, so I'm afraid I wouldn't offer great advice other than to really empathize with the challenge.
Before I move to Joanne for her to answer, I'm happy to be put on the spot on that, and I would encourage participants to please again send us an email if you would like us to get a couple of educators in the special education world or strategies to do one of these sessions. If that would be helpful, we're happy to explore that, but we'd love to know if that would be helpful to participants. Joanne, did you have any thoughts either about that specific RIPIN webinar, if you know about it, but otherwise skills in general for online learning?
Yeah, all of the RIPIN webinars are absolutely worth it. They're chock full of information, and theirs are also online, so you can do it at 2 in the morning or 2 in the afternoon. The majority of theirs are just log in and watch them when it's convenient for you, and it's good information. As in terms of support to help your child be engaged, we were lucky to receive a grant from the Rhode Island Foundation, the United Way COVID Recovery Act, just for that very purpose. And we had our staff, families who were struggling, call in, and first we had our family support specialists or parent consultants, talk them through. Was it just, we all want to jump some days. Where are you emotionally? How can we help you? But then the parent consultants and some of our school consultants called and Zoomed with about 75 families to find out what the struggle was, and how, and again, we're parents, our kids have been away at school, and then they have HBTS or pass in the afternoon, and we really haven't learned as many of the strategies that are actually pretty simple if you know them, to help engage our children. And so our team worked with families, and we not only did we give them ideas and some information specifically to their child of what would help, we sent them the visuals and the supports they needed the next day in the mail, or we sent it to them electronically for them to start to learn how to engage their child, and again, how to give them the information they need. And also how to figure out, for some kids, just being in front of a computer is just not going to be what it's going to be. And so maybe working with the school for the fall to say, she can't do the online the way it is. We need some help in introducing it to her or educating her on it, or we need a modification. We need work sent home that she can do, other ways that she can be taught if it comes to that. But I would encourage the mom, give us a call. We're happy to work with you to try some things through the summer to see if that helps, so that you can make an educated ask of the school to say, we tried this too, and we tried this, we need some more help. And getting all kids engaged on distance learning, because I know we as adults, we're all zoomed out, after a while. And so these kids, for 6-8 hours a day, are there other ways that she can access the curriculum, do what she needs to do, but make it so that it's less stressful for her?
Dr. Vivier, I'd also add, a lot of these questions which are really good, thoughtful questions today, have to do with resources and what's available out there. And we have some wonderful local resources here in Ripen Autism Project, some of our resources on the Reichart webpage. But we also want to use what's out there nationally. So, so there are organizations such as Autism Science Foundation, Autism Speaks. Other universities have called together resources. I've been looking at some at the Duke University Autism Center, for example. So I think we can make, both Joanne and I'm sure, can pull together some of those links and make sure that the Hasselfeld Institute has those available. They might be useful to post on a website so that people can look around, and not every resource is going to be right for every family. We want a menu of things. So, you as families can really figure out what's the best fit for what you're needing right now.
That would be, yeah, that would be great, Dr. Scheinkoff. And I just wanted to jump in and say that, someone did message to say that they would love the link to the Ripen webinar. So I'll make sure that we get that and that it goes out in the email I send afterward. And someone else also just jumped in to say that the website understood.org has some great ideas on how to engage students that learn differently. So I'll also be sure to include that link in the follow-up email as well.
Great.
Great. Well, I'm going to stay in lightning round because we don't mind going a few minutes over, but I know people have to go. So lightning round, we have both a teacher's assistant, who's the person that this teacher assistant is working with will not wear a mask. And the teaching assistant has to help with toileting and eating and a whole range of things, and is just worried about keeping the student safe. Similarly, a parent wrote in that the son requires close contact at times to calm them down, when that is a strategy to calm down, and is just worried, is this going to be a big problem in the school, knowing that a close contact is unavoidable. It's part of what needs to calm down. Joanne, do you want to start with those two?
Sure.
The issues?
Yeah, I think a lot of people are talking about this type of thing because a lot of teachers and staff in schools are a little nervous about going back. But I think perhaps if conversation with the school that this is one of the strategies that's used, perhaps talking with a medical professional on the proper level of PPE or protective wear that they can wear and give him a hug safely. Or is it that is it a small enough in your pod and your contact tracing? Is it appropriate? But if you gear up like a dentist does, or I went to the dentist the other day, holy smokes, it was 60 degrees because everybody had so many layers of PPE on it, but they felt safe. And maybe when she's toileting him or changing him, if she's got the mask, glasses, and maybe one of the shields in front, that will keep him safe. But I would, with the teacher assistant too, make a video, have on your phone showing, hey, I'm going to be safe today, and put the mask on and let them watch it over and over and over again, and just try it from every different angle to get the information as to why the mask is safe. And if you can say you just need to wear it for the 10 minutes while we're toileting, and you have a countdown timer there so they know it's not the rest of the day or whatever the time limit is that you have to put on it. Again, it's giving them the information, but also giving the staff the information of just how much cover up do they need. Do they need the gown, the paper gown, and the gloves and everything else to do some of this stuff? And if it's not, we need to work with the school to figure out another intervention or support to help this child stay calm and safe.
Great. We're going to stick with lightning round. Thank you for that. Dr. Scheinkoff, you'll get the next one. Daughter is overeating a lot from the stress of this, as we actually our last webinar for the Hassenfeld was just generally routines and healthy eating. Do you have recommendation of a nutritionist who specifically works with autistic kids that you would say, or we can research this and put something on web and get back to the parent on this, but anything off the top of your head?
Yeah, I don't know a name of a nutritionist offhand who on an outpatient basis works with people with autism, but I think that's something that we could reach out to colleagues at Bradley Hospital to see if they have some suggestions, and maybe place that on the website as potential resources, because there are folks out there who do like working with autistic individuals and may be very helpful. I just wouldn't be able to pull their name out of my hat.
We will get that on the website, and we'll also include our healthy weight team at the Hassenfeld Institute. Joanne, specifically families looking for resources if they're looking for past workers. Any quick advice for that, or ways that we can point them to resources?
We need to point you to some resources that, you know, that's always a challenge. But the universities, kids who are either medical school or the human sciences down at URI, different places, are generally a place to go. Some people put it out on different places through social media to find people, because you always have to do background checks and everything else to find the staff. But when you see them, grab them because, you know, yeah, it's hard. But you know what? Call us, because Sue and Alicia probably have other recommendations too. And we like to give out lists of different places where you can go so you can choose what's best for you.
Great. Dr. Scheinkoff, we need a psychologist for this that I think we're all struggling with. How do you explain to young kids what COVID-19 really is? As a person, as a neurotypical adult, finds it scary. How does he explain it to his nonverbal toddler?
Oof.
Yeah, well, a nonverbal toddler, I think, is going to be hard to explain things to, and I think you want to keep things concrete. So COVID-19, you know, this microscopic virus that makes that a very abstract concept, right? So I think focusing at the level that the individual really thinks and can understand is the way to go. So for younger, less verbal individuals, I think talking about things in the here and now that you can see and touch, masks, the need to maybe not touch when you might otherwise touch, those sort of concrete, more tangible things may be the things to focus on, and to think about how to deliver that information. So the nonverbal toddler is not going to likely understand a lot of language. So visual supports, simple social stories, I think are the way to go. Some of the resources that I've been peeking at through some of the things that we'll make sure there are links to have some ideas on this in terms of out-of-the-box social stories or terminologies that you can begin to use with individuals. But I think a lot is trying to match the language and how abstract things are. I think the adolescent who is verbal and in regular education classes can understand things, right? We just need to spend the time to explain them. I think the other thing I think about, and I'm not an epidemiologist, so this is my psychologist speaking, is that we need to understand that there's two things. You know, we want to protect ourselves and those close to us, but you know, we also the risks may be greater for our, not less so for our individuals, but for our community. And so I think differentiating for kids and maybe for ourselves too, things that we do that are reasonable precautions to keep us safe, but to do so without panicking is important. So don't overplay the risk to individuals, but take reasonable precautions, while at the same time recognizing that we're doing things like wearing masks, like maintaining physical distancing, like remote learning when necessary, because we're caring for each other in the community as well. And helping people think about that, I think is a conversation we should all be having with ourselves. And we should not be afraid of having it with people who have varying levels of disability or differences in learning or language. I think that's, you know, good for everybody to talk about those and distinguish between those, you know, the purposes of why we're taking these precautions.
That's great advice. We're at the hour, but we'll spend a couple minutes to see if we can stay in lightning round to get through these last questions. Joanne, this question is about a child who has an IQ at 72 with autism, but dreams really big and wants an occupation that requires 4 years of college education, a computer animator. How do you speak realistically without crushing dreams? You know, particularly when they may already feel less than, as the way the parent has put it. How do you balance that of big dreams that we always want our kids to have with what's realistic? Do you have advice there?
Yeah, sounds familiar with my son who now wants to open a bakery, or be a musician. And what we've tried to do, even with his brothers, one of his brothers played baseball, and after a while, wanted to go and play in the big leagues, and a lot of our kids, all right, I'm going to be a baseball player, I'm going to be this, and we work with them to say, well, how is that going to look for you? In terms of the baseball player, okay, how many kids play Little League? 1 million. How many kids play high school ball? 100,000. How many kids play college ball? 10,000. How many kids play in the pro, get drafted to the pros each year? 30. Those are pretty good odds. But guess what? You are a statistician to end all statisticians, and you can work in baseball and be in baseball through that. Or Patrick, you love to sing and entertain. You can take voice and guitar lessons and come up with a show, and you can do nursery parties. So really work with him if he wants to be a computer animator. Well, what does that look like for you? Okay, who can you be? Who can you be drawing animations for? Can he learn the software that he can make up his own computer animation for, a preschool or something like that? Not saying you can't do it, but there's, for every job or every industry, there's 1,000 different jobs, and if you want to be in the theater but you can't sing, guess what? You can be one of the people who has people, ushers them to their seat. So you're around your people and people who like the same things as you.
I love that. I love the notion that a young boy like that has that sort of ambition and enthusiasm about something, and we don't want to quash that. We
No.
want to really nurture that, yeah, finding ways to, to be part of the team in the topic that you're really interested in, I think is essentially another way of what you're saying, Joanne. People can be really important members of the team at all varying levels.
Yeah.
And that may be in the end what this young person might mean about being an animator.
Last two questions we'll get through lightning round. I do think that was wonderful response to that important thing. And also let people know we've gotten some suggestions of other resources that we'll incorporate into the final thing. Dr. Sheinkoff, my son is 16. This parent writes, with high functioning ASD, still has long-term struggles with processing skills that the district's not managing well, and you get caught in this 22 of they either need to pay for testing to prove they need it, but then you can't do the testing. Thoughts for a 16-year-old with high functioning autism who's having trouble getting services?
If I'm understanding the question correctly, part of it is what assessments can be done in the COVID-19 period of social distancing?
Well, I think it's also not being able to pay, but potentially it being so expensive that they're requiring special testing to qualify. And they specifically said, I'm not familiar with this program, ESY benefits that have been lost. And how do you get around that catch-22 of they won't give the services until you test to show it? You can't get them tested to show it.
So ESY, I'm assuming what they're meaning is extended school year, which means summer services for the school. And I think schools honestly really vary, districts vary in terms of how liberal they are in terms of handing those benefits out. And they're not always the right benefits for all kids, to tell you the truth. So focusing only on ESY may or may not be the right thing given that circumstance. With regard to testing and processing speed and those sort of barriers to learning, I think the right neuropsychologist for a teenager or a school-age child is going to know how to articulate the problem in a way that, assuming the family has appropriate insurance, can be paid for. So I think it's about seeking out a neuropsychologist who can really listen to the family. What is this person struggling with? And articulating the problem so that it can be appropriately authorized for for psychological testing, so to speak. And that really, what that means is that there needs to be some articulation that this is a challenge that is not just around school, but also around general opportunities for learning and adaptation outside of school as well. And if that can be articulated, I think generally insurance companies say, yeah, this is part of a child's healthcare needs and it can be paid for. So I think reaching out to your insurance company and getting a list of neuropsychologists specifically in the state and calling them and telling them what the needs are. And I think if one of them provides it makes sense sort of answer, I think that's the way to go.
Terrific. I'm going to give and I'm assuming if there are other things we can get on the web on that, we'll also work on that. The last question I'll send to you, Joanne, is how can adults diagnosed later in life find support? Are there quick answers to that, or is that something we should just add to our web resources as we do that? Do either of you have any quick answers to that?
Give us a call, because we're getting more and more adults and listening to them as to what they need. And we can put you in contact. There's some adult support groups. There's some adult leisure groups in the state, different things. And we can find out what it is that you need. And again, you'll be teaching us. And we can go and find to see if it exists and work to support you in what it is that you're going to need and what you're looking for. We'll do our best to connect you with the resource in the community.
I'd also say, Patrick, that the question alludes to two kind of different groups of adults: those who have grown up having had the diagnosis made when they were younger, and they're going to have a different kind of connection to resources than the adult who comes to the diagnosis, during adulthood. And those are very different experiences, I think.
Yep.
One thing I think can be generally true for those people in those circumstances is that they are not always, but often going to be folks who have jobs, are verbally quite capable. And in addition to the types of community supports that Joanne mentions, there's also, and I say this as a therapist, as a psychologist, there are also psychologists, social workers out there who can be part, not the only thing, but part of the support structure for people to help work through those sort of struggles and challenges. And so I have two messages. One message is to the adults in those circumstances, which is to also reach out to mental health professionals to seek out that support when you need it. My other message is to the mental health community, which is just because somebody comes to you with a diagnosis of autism doesn't mean that you don't have the skills and the capacities, because you do through your training, to really help individuals. That the label is just a label at that point. And I think it's like any individual finding those sort of leverage points to help individuals, get to a little bit of a better place in life, and feeling confident in that as your skills, with your skills as a therapist is really important. And don't get distracted too much from the diagnosis, actually.
Yep.
Well, on that note, I want to thank both of our panelists. You've been fantastic and helpful. I want to thank all of the participants and for your wonderful questions. I know we've already gotten some thank you to the panelists come in from the participants. We will get this, Amy will be in touch with follow-up information, including this recording, as well as many of these resources as we can to be on our website, as well as our email address, that if we are missing things that really would be helpful for the community to make sure we have out there, we will do that. So thank you to our panelists, to our, Amy and the technical crew who did this. Thanks to all, and thank you most importantly to the participants.
Thank you.
Thank you very much.
Thank you, Dr. Vivier, for moderating. Thanks to everyone for joining us. Thank you.
Thank you so much.